I'm here with Jerad Bachar, President and CEO of Visit Pittsburgh. Thank you for being with us today.
It's a pleasure. Thank you for the invitation.
So in a typical non-pandemic year, as far as revenue, visitors, and jobs, how much does tourism bring to Pittsburgh and Allegheny County?
Well, tourism is a big part of Allegheny County's diverse economy. In pre-COVID times, tourism represented about $6.4 billion worth of direct spend into our economy, supporting over 43,000 jobs and creating around $400 million in state and local taxes. That entire revenue stream, economic input, has certainly been decimated over the last 17 weeks. And we've seen that on a lot of levels throughout our business community, our hotel performance, passengers going through Pittsburgh International Airport, and so forth. It's been completely decimated from an economic performance standpoint.
And so many businesses have been affected by this pandemic. As far as tourism, I'm sure hotels, restaurants have all been affected. Is there a particular sector, if you will, that has been particularly hit the hardest?
Across the board, and including the businesses that you mentioned, we look at various hotel or market performance indicators. Hotels are certainly one of those market indicators. As we look at hotel performance occupancies over the last 17 weeks, we have measured 1.1 million fewer hotel rooms being sold here in Allegheny County during that period of time compared to the same time last year. That equates out to about 2.9 million fewer people who have stayed in these hotels. And that expands out when we look at the number or the value of spend that those consumers have. It represents around $400 million that is completely gone. It's just evaporated from the market compared to performance the same time last year. But you can have that same conversation around restaurants, our attractions, our cultural sites. Our theaters, of course, have shut down, and their next season is certainly at risk. Many of them saying that they're not going to open or be able to open until 2021. But you can have that same conversation across the board for all of our various business sectors within tourism. As we are evaluating the impact of loss in revenues, that's certainly very impactful. That number is astounding. But in addition to that, the job loss is also greatly astounding. Our forecast right now is we're expecting to see around 24,000 jobs lost in 2020, specifically within the travel and tourism sector. So those 24,000 people who are not going to be working because of this pandemic.
Have you seen any kinds of improvement in people moving around and visiting Pittsburgh since at least shifting to the green phase and the summer weather improving?
We've seen some. We've certainly seen some. You know, for Pittsburgh and for many destinations across the Commonwealth, there is an opportunity for us to attract regional travelers, and that's certainly the case here in Pittsburgh and in Allegheny County, and even in our surrounding counties. We're all very dependent on individuals who live within this region, within an hour or 2-hour drive market or drive time to come into Pittsburgh. Many of our attractions and our museums, our Gateway Clipper fleet who sails on the Allegheny and the Monongahela rivers, all of these attractions and experiences have now reopened in the green phase, and we're seeing people starting to come back. The challenge that we're facing today is the limitation on availability of restaurants. Capacities, of course, have been rolled back by the state, and we completely understand that. We completely understand that health and safety measures need to be taken to keep us all safe. But we're also concerned about the ebb and flows of policy that are affecting our business partners. Our restaurants are the primary victims of that policy cycle, if you will. So we're concerned about making sure that policies are set that still support businesses. You know, the 25% occupancy for indoor dining right now is almost impossible for many of our restaurant partners to really even think about operating. That level of revenue for them is it just doesn't substantiate enough for them within their business model. Their margins are already razor thin. So the concern that we have is, first of all, we need to get policies in place that support a sustainable long-term business model. And I think we're in this for a sustainable long-term period. But once those policies are put in place, we need to stick to those policies as much as possible, giving these operators the ability to open their businesses, keep their employees at work, and still promoting a safe and sanitary work environment.
You introduced the Rediscover Pittsburgh initiative. What's the goal of this initiative?
It's really to bring awareness to our regional consumers, making sure that they understand what our experiences and opportunities exist in Allegheny County and even within the region. There is certainly opportunities for them to come, have a family holiday, stay in our hotels, eat in our restaurants, visit our museums and attractions, get out onto the river, get out onto any of our cycling trails and so forth, making sure that those consumers within the region really understand what opportunities are here. Many of them, of course, have been to Pittsburgh many times. A lot of people who have grown up in this region have been to Pittsburgh and everything that we have to offer since they were a kid themselves. So we're trying to encourage people to come back and rediscover Pittsburgh so that they can enjoy a summer holiday, enjoy an experience outside of their home, which they've been confined to for so many weeks, but be able to come back and rediscover something that they probably already know, but want to come back and take a fresh look at.
You mentioned some of the things that people are able to do in Pittsburgh. What are some of the activities or things that people can do in Pittsburgh that you're encouraging people to do and that are safe and available for anyone?
There's a lot that we've seen come back to an open status since the green phase was announced several weeks ago. Our museums are leading the forefront of that experience, going to the Heinz History Center or to the Carnegie Museums. And others. A lot of these organizations have put measures and guidelines in place to allow consumers to come in and almost have a completely touchless and social distance experience that moves them through these facilities, lets them experience the exhibits and the various things that they have on display, and really take all of that in and do it in a safe manner. The Phipps Conservatory is another great example where you can go and visit the various gardens and do that in a way that is the safety protocols really allow for a wonderful experience, but you're still very much in a safe environment. The zoo is another great example. We have lots of individuals who have experienced the zoo, either from their car or walking through the various exhibits. It's also a wonderful way for families to get out and have a great time. As I mentioned before, getting out on the river, getting on the Gateway Clipper fleet, getting in kayaks, renting cycles, taking a walking tour. We've got wonderful tour operators who are still here offering walking tours in and around the downtown area that are also done in a very safe and secure manner. So there's a plethora of opportunities for sure.
Pittsburgh is also a really big sports city. How are you working with those athletic organizations in the city to hopefully get a positive outlook on getting those sports back to getting the sports back and getting people back to those sports?
Yeah, that's a great question. Sports, as you know, is in the blood of everyone who lives in this area. Our sports teams on a professional level certainly have been doing everything that they can to get their games or their sports back up and running. We're waiting to see how baseball starts to prove itself now that we're starting to get into that season. Football is another thing that we're on the edge of our seats trying to see what's going to happen there. The Penguins have been fighting to get games and play to get games back here into Pittsburgh. So they're fighting certainly on that level. We're working with a lot of regional sports organizers, certainly with youth sports and other competition, levels of competition, to try to get them to hold events here in this region. But again, all of that conversation is happening all around health and safety. How can we make sure that these sporting events really can be held, but to do that in a way that we're protecting our guests, our visitors, our residents, and certainly the athletes themselves. So it's a difficult situation, and that conversation changes really every single week. As we look at the various levels of cases that are in Allegheny County and in this region, all of that has a direct impact on what we can plan for the future weeks. So at this point, sports, youth sports, there's some outdoor youth sports that are being played, but most of our sports, 90% of our sports, is really just off the table at this point, unfortunately.
And finally, I know it might be tough to say because you mentioned that a lot of these solutions that you're discussing have to be sustainable for a long period of time. But how long do you think it will be before the volume of visitors and activities that we had before will be able to return?
That's the billion-dollar question. As we look at various forecasting models, there is certainly a varied approach to recovery. We know that our leisure tourism is going to be the first to recover. People certainly within the region are going to be coming back into Pittsburgh and into Allegheny County first. We're already seeing that. And then certainly our national and even our international visitors will all come at a certain time into the future. International, of course, is quite far into the future, as based on our estimation. But even other parts of tourism, whether it's sports events and business events, which are conventions and trade shows, at this point, we're not expecting those to come back until 2021. But all of our forecasting models that we're looking at really are not showing tourism to get back to pre-COVID conditions for another 2 to 3 years. We're looking at a long-term recovery. We'll see some short-term opportunities, but a long-term recovery back to pre-COVID is going to take years.
All right, Jerad Bachar, President and CEO of Visit Pittsburgh. Thank you so much for your time.
Thank you.
Did you know you can watch all of your favorite PCN originals and more at home or on the go? Download the PCN app on your favorite device and tune in to see what makes Pennsylvania's heart beat. Watch videos on demand, see multiple live streams, and check out the free selected programs and events. PCN, Pennsylvania Politics and Policy, History and Culture, Sports, and more.
I'm here with Dr. Monica Taylor, Vice Chair of the Delaware County Council. Thank you for being with us today.
Thank you for having me.
So in the past 2 weeks, Delaware County has experienced an increase in COVID-19 cases. What are some of the ways that the county is trying to mitigate this new increase in cases?
Some of the ways that we're trying to mitigate the increase in cases are to, of course, last week we had an announcement just to remind people of what the regulations are and guidelines are for bars and restaurants, and then also reminding people which states are having a massive increase and that we're looking at people quarantining once they come back, and reminding people just to be cautious and try to abide by the guidelines, even when they're out on vacation and at the beach, and just keep in mind that even though we're in a green phase, that doesn't mean that we can't get rolled back to yellow. So trying to make sure that we keep up on the masking and the social distancing is really key and important.
And what do you attribute this increase to? What are you tracing some of these cases back to?
Some of the cases have been through our contact tracing. Some of them have been attributed back to the beaches, back to various vacation sites, back to just simple restaurants or bars. And so that's why we kind of just wanted to make sure that everybody was aware and up to date on what the guidance is.
And is there a specific demographic that's being affected most by this new increase in cases? Because traditionally the virus has affected older individuals. Is that still the same case?
Well, no, actually, we're starting to see an increase in cases in our younger population. So that 18 to 24 bracket that's where we're seeing a big increase at. And that's kind of where you get the vacationing at the beach. And then, they're younger, they're not as aware of what's going on. And so that's kind of where we're seeing that spike right now.
What is testing like in the county? Have you had to expand testing since this new spike in cases?
We haven't had to expand since the new spike. Our ultimate goal had always been to try and get as much testing as possible. And now, so we have testing available at all of our health networks, but then we also have county testing. And what we do for that is it's a weekly site that's at a different municipality around the county. And that site is chosen by the health department as somewhere that maybe we need to get more testing in, need to get more eyes in those areas. And that's kind of how we've been going about it for the summer plan. And our ultimate goal has always been, since the pandemic started in the beginning, there was such a shortage of testing kits or a shortage or slow and lab turnaround time. And so we've always been trying to get to a point where we have enough and ample supply of testing. And I think right now we really do.
You mentioned earlier this week you made an announcement just reminding people about some of the guidelines that they had to follow. Could you just describe some of those guidelines for bars and restaurants and businesses allowing customers into their place of business?
Yes. Well, so those guidelines originally last week, where we were just reminding people that they weren't allowed to stand up in bars, that they had to be sitting at a table, they had to have a mask on unless they were eating or drinking, those type of things. But the governor just released new guidelines yesterday with more enforced mitigation efforts, because I know that a lot of the cases in the western side of the county, like western side of the state, like Allegheny County, a lot of those are attributed to cases that started in the bar and spread with their contact tracing. And so he's kind of put out a new guidelines for bars and restaurants to follow, which are much more restrictive.
And what has been the response from businesses in the counties to these mitigation efforts?
I mean, I think the response has been great because really the majority of the businesses and the restaurants and bars are abiding by the guidelines and trying to make sure that they're keeping their employees and their patrons safe. It's just a few bad apples out there that weren't really doing what they were supposed to do. And I think the restaurant owners have been very going with all the guidelines and trying to, they're like, yes, we want to make sure that those bad actors get reprimanded because they see the point, right? The big picture is if we can keep the numbers down and if people abide by the guidelines, then everyone stays open and we don't have to go back to a yellow or red. And that's really the whole point. We're trying to make sure everyone stays open.
Can you describe what the Delco Strong program is, particularly Delco Strong 2, and how it supports businesses in the county?
Yes, so Delco Strong 2 is a grant program, and so it's not a loan, it's a grant that we are giving to small businesses, and so there's two pieces of it. One piece actually just closed yesterday, and that piece was to small businesses, and then the next piece is to nonprofits. And so we know that people were hit hard, and companies and nonprofits and small businesses in particular were hit hard because of things like the closings and the mandatory shutdown. And so we're trying to help kind of offset the cost that they were hit, just by giving a few $1,000s to the organization so that helps them offset their standard costs of rent, of employees, so that they can keep their employees employed. And, hopefully we can get through this.
And how do people apply for some of these grants?
So they can go to our website. There's actually a link on Delco.gov, and they can go to the Delco Strong. So the Delco Strong 2 for small businesses actually closed yesterday. So yesterday was the last day to apply for that. And the nonprofit one is still open.
How are you advising schools in the county to reopen in the fall?
Yes, I know this is such a complicated issue because it's a fluid situation, it's just every week and even every day is different. And what we've been trying to do is work closely with our school districts and, work with the Chester County Health Department. And they've given school districts guidance to kind of help them figure out how they're going to do their health and safety plans and what works best for their school district. We have 15 school districts in the county, and every single one is different. Different in size, different in demographics, different in like the layout of their buildings. Some school districts have large, newer buildings that have wide hallways, and the classroom size might only be 15 to 20 kids anyway, where other districts have large buildings and 30 kids per class. So each one is really different, and their plan is going to be specific to them.
With protests still happening all over the state for social justice, how are you working with individuals in marginalized Black and Brown communities to address issues of not only health disparity, but all other issues affecting those specific communities?
Well, some of the things that we've been trying to do, let's just talk about the health disparities in general. In some of the areas, we've seen some of the hardest hit areas have been our Black and Brown communities in the county, and that they are having a higher percentage of deaths compared to other ethnicities. And one of the things we've been doing is trying to get more testing in there, get more wraparound services in those areas, get more information in those areas to help those individuals. And then another thing that we also are doing, looking at the social justice side, is our county district attorney has assembled a criminal justice reform task force that has different pillars. And, those pillars are looking at policing, they're looking at the prosecution process, who we lock up, why we lock them up, all of those things. And then also, we are also looking at government function and how the government and the community can intersect better. And then how we as a government, what policies we can put in to improve equity across the board.
And finally, looking forward to the rest of the summer and the fall and the rest of the year, basically, what are some of your biggest concerns for the county?
Well, I think one of my biggest concerns is, of course, once school starts back up, and making sure that all of our kids, all of our teachers, our staff, our families are safe in the county, and that we don't see a spike from schools opening back up. And then also that just whenever our spike, if there is going to be a spike, trying to make sure that doesn't happen and doing everything on the front end that we can, because now we see it coming, right? Before, we had no idea it was coming, and it just kind of hit us like a ton of bricks. And right now we have some time to prepare and to get ready and to put things in place like more testing, train more people to do more testing throughout the county, and hopefully one of my worries is that we're going to have another supply chain shortage like we had in the beginning on testing kits and PPE and all of that. So we're trying to prepare ahead of time for that and make sure that we have enough test kits available to test as many people as we can, and that we kind of load up on our PPE so we can make sure that we keep those entities in the county supplied with PPE, like our hospitals and our schools and those type of things. So that's kind of what we're looking at, just trying to be as prepared as you possibly can. You know, nobody knows what's going to happen, but at least we've gone through it in the spring where we had to like do everything like on the drop of a hat and didn't really know how we were fighting this. But now at least we have somewhat of a playbook and are trying to, you know, figure out what we're going to do to combat it as it comes at us.
All right, Dr. Monica Taylor, Vice Chair of the Delaware County Council. Thank you for being with us today.
Thank you for having me.
The eyes of the nation are on Pennsylvania as a key influencer to the 2020 election. PCN has over 25 years of trusted state government coverage. Our network is your platform to connect directly with Pennsylvania voters. Whether it's a presidential race, statewide campaign, or local cause, our viewers are ready to hear from you. Book your ad now. PCN, your access to Pennsylvania voters.
I'm here with Dr. Timothy Craig, Professor of Medicine and Pediatrics at Penn State Hershey Medical Center. Thank you for being with us today.
Thank you, Liaga.
So COVID-19 is manifesting in people in different ways. One challenge that some people are facing is that they can't tell the difference between their allergy symptoms and the COVID-19 symptoms. Can you talk about what the difference between those two could be?
Yeah, so that is a major problem, especially for us and ENT physicians. I'm an allergist, because people might think it's just their allergies to, like, this time of year, grasses are blooming. There's also a lot of ozone in the air and air pollution this time of year because of the inversions. So yeah, it is very difficult, except for allergies rarely cause a severe sore throat. You can get some sore throat and usually cause itchy, where COVID-19 usually doesn't cause itching. Often people lose their taste and smell with it. The throat pain is greater. Fever is not always there, but often, and that should be a sure sign that it's an infection and not an allergy. So that's what we try to discriminate about. Is it their allergies with itchiness and sneezing, or is it an infection with a bad sore throat and fever? So that's how we kind of make that decision.
And just to clarify, can someone who typically experiences very strong allergies be considered to have a pre-existing condition that would make them more susceptible to being a high-risk person for COVID-19?
Yeah, that's a good question when you ask it allergies. So I am not aware of any literature that shows that people who have allergies per se just affecting their nose and eyes are at increased risk. But if you have allergic asthma, and it's especially severe asthma, yes, there is some data suggesting you're more likely to get sick and have a severe infection. And the same if you have COPD from smoking, you're at a greater risk of having a poor outcome. So in that sense, but if you just have tree allergies or ragweed allergies or grass allergies, I don't think there's a link that we have yet. But definitely bad asthma puts you at a higher risk.
And for people who do have those pre-existing respiratory health issues, even as states begin to reopen, what are some of the extra precautions that they should probably be making?
Yeah, so I think hopefully everybody's doing it, wearing masks and with the nose in the mask, not the nose out of the mask, staying indoors as you can, but at the same time being outdoors to get your exercise, but not to congregate with large amount of people. So very similar to what the governor in Pennsylvania or the governors of most states, not all states unfortunately, but most states are suggesting is what you should do. But definitely the mask protects you a little bit, but it protects other people around you. So just insist that those people around you do wear a mask when you are in a setting where you can't easily social distance.
And can you talk more about how air quality where someone lives can be linked to some of those respiratory conditions that put people in a high-risk COVID-19 group?
Yeah, so it's kind of interesting. First of all, the aerosol is often, if we talk about aerosol, is PM 2.5. So it's about the same size as most air pollution. And so what happens, there's some good data, not a lot of publications yet, but there's some good data out of Harvard that suggests if you're in an area with a lot of air pollution, and maybe that's why some of the racial variation, where there's more likely to affect African Americans and minority groups, and maybe even they get even not increase in infection, but also worse infection, is because often people who are at low income often live in neighborhoods where they're near adjacent to highways where there's air pollution, or that they live down what do you want to say, downstream. That's awful to say downstream, but down from air pollution, such as burning waste or some other chemical and industrial waste. So there is good data to suggest if you have a lot of particulate matter and you have air pollution, that you're at increased risk of getting the infection, and if you do get the infection, you're at an increased risk of having more severe infection.
And for people who experience the more severe infections, what is it about COVID-19 specifically that makes it so damaging to people's respiratory systems?
Oh, that's a good question. If I could answer that, I might get a Nobel Prize this year. But so what happens, it looks like you get the virus, and the virus seems to be able to some way stimulate an immune reaction. And that immune reaction gets out of hand, and it's that inflammation in the lungs that really lead to people having that severe pneumonia. Now, if you fight the infection and you don't get this cytokine storm, is what we call it, a cytokine storm, because of all the proteins that are secreted, you can recover pretty well. If you do get this cytokine storm, these are the people that end up needing oxygen and then intubated and then ultimately die, unfortunately.
In more recent surges of cases, we're seeing the trend of cases shifting more to young people, and some people who are experiencing very severe cases of COVID-19 even have lung damage and scarring. For those young people who experience that damage, is that something that they could recover from, or once that damage is done, it's permanent and makes them more susceptible to health issues in the future?
Yeah, so that's also, obviously, it's a good question. You wouldn't ask a question that wasn't a good question. So, but when you look at that, it's really too early to determine. But, it does bring up that whole issue that young people are at low risk for dying, and I think that causes them to be careless. But what we don't have a lot of data on is how many people are going to have changes, like you said, that may be permanent. The basketball players and baseball players and so on right now are getting tested on a regular basis. And they insisted upon that because they know if they get an infection, they may not be able to play their sport again. So I think it's in everybody's mind, but the exact percentage of people will have significant morbidity or lung disease that's going to interfere with their quality of life in the future is really not known. But I'm really concerned about that, because what we see are numbers of people getting sick, and we see numbers of people who are dying, but we don't see those numbers easily of the people in that gray area who have significant lung disease and may have symptoms that persist forever.
And for people who maybe don't have pre-existing lung conditions, what are some breathing conditions? What are some ways that people can bolster their immune system or their lung health so that they could fight off not just COVID-19, but any sort of disease that might be similar?
Yes, I always say try to exercise. Exercise is very important. Try to eat healthy. Try to do the social distancing, wear your mask, wash your hands. If you're a smoker, don't smoke. Because that compromises your immune system, making it more likely to get an infection. And if your infection does occur, to make it worse. Vaping, you would think the same thing, because you really affect your ability to fight off infections in your lung. So just healthy living is what you really need to do. And that, I think, pays off in the long run, overall for your longevity on the planet, but also hopefully to get you through what's going on with the pandemic.
And finally, what are you and your colleagues in your field most concerned about as the pandemic progresses?
Well, if we all have our different ideas of what's going to happen, what I'm really concerned about is what's happening right now, where in the South and the West, where there's now a rise in number of people who are getting it, and there seems to be a lot of carelessness on governments and also on people themselves not wanting to wear masks and so on. I also really are worried about come fall. Now, and the reason I'm worried is not that I expect a big, huge number, but then we're going to have the regular flu. We're going to have COVID. It's also all the common viruses, such as rhinovirus, that cause a cold. So all of them are going to come in the fall, and to decide which it is. Plus, we'll have ragweed allergy and mold allergy. So to decide which it is it COVID? Is it a regular old infection that you get every year, or is it the flu, or is it just bad allergies? It's going to make it very, very difficult for the healthcare system and for individuals.
All right, Dr. Timothy Craig, Professor of Medicine and Pediatrics at Penn State Hershey Medical Center. Thank you so much for your time.
Thank you so much for the opportunity, and you have a great day and be safe, please.